Okay, we're about ready to start. Can everybody hear me? Please indicate in the chat box if you can hear me. Okay, okay, you can hear. Yes, good. Very good. Okay, we're going to have a very interesting talk today. Probably a lot of stuff that you haven't heard of before. Some of it you have. We try to make it interesting. So let's go ahead and jump into it. Okay. Okay, here we go. Imperative things to know about calcium metabolism. Calcium is the single largest mineral by weight in the body. Of the total calcium in the blood serum, approximately 1/2 is bound to serum proteins, meaning chelated. Only the free calcium ions are biologically active, but note you have to have the bound part in there so that you can have the free calcium ions to be biologically active. They're important for controlling irritability of nerve cells, in other words, nerve function, blood clotting, contraction and relaxation of muscle, adhesion between cells and production of milk, mineralization of bones and teeth. Hypocalcemia leads to tetany. Hypercalcemia may lead to bradycardia, ventricular arrhythmias, and ventricular fibrillation. Okay, so how many of you knew, indicate in the chat box, that hypercalcemia could lead to bradycardia, ventricular arrhythmias, and ventricular fibrillation? I like to have interaction on this, so please type in there. Okay, yes, yes. Everybody interact here. Let's have interaction. Yes, okay, good. Not all of it, okay. Yes. Okay, so you knew, for example, that if you had bradycardia or arrhythmias, you need to get the calcium level down. So that's a big part of it right there, okay? And ventricular fibrillation. Now, basically, what we learned in chiropractic college for ventricular fibrillation was to do a massage of the carotid sinus, okay? Now we know hypercalcemia can also do that. Of course, older individuals, most likely that have bradycardia, and if you remember when we were discussing somewhat on thiamine, which we're going to talk about at a later talk, the B vitamins, bradycardia can occur, or tachycardia with a lack of thiamine. Okay, the homeostatic control of calcium level is dependent on the function of 3 tissues, bone, kidneys, and the intestines. This regulatory process is controlled by 2 hormones. Calcitonin which responds to hypercalcemia, and parathormone, which responds to hypocalcemia. Here we have two counterbalancing hormones, one to decrease, the other to increase blood calcium levels. Now, these fluctuate all the time, but it can take a while for certain ones to work. Calcitonin, or thyrocalcitonin, is a polypeptide produced by parafollicular C cells of the thyroid gland. Secretion of calcitonin is stimulated by an increase in blood calcium level of as little as 0.5 or 0.15 to 0.5 milligrams per 100 milliliters. It's not a lot. This hormone increases bone calcification by inhibiting bone resorption, thereby decreasing the blood calcium level. If the parathyroid glands are removed, as in the case of a malignancy, tetany may occur, that is parathyroid tetany. Parathyroidectomy is accompanied by a decrease in the calcium level of the blood. The tetanic symptoms are related to low serum calcium ion concentration, since the intravenous injection of calcium relieves these symptoms very quickly. Parathormone, PTH, parathyroid hormone, is a hypercalcemic hormone. That is to say, it functions to elevate blood calcium levels. PTH is also a polypeptide, and the bovine hormone has a molecular weight of 9,500, is composed of 83 amino acids. When the serum calcium level is reduced below normal, PTH is released from the parathyroid glands. It increases the resorption of bone, the absorption of calcium from the intestine, and the renal absorption of calcium. Parathormone responds and restores the normal level of calcium with a span of 4 to 6 hours. So it takes a while for this to occur. A lot of hormone reactions take, seconds to occur, but this is pretty long term. In the absence of parathyroid, EDTA, a chelator, lowers the calcium level, which subsequently remains at a reduced level for as long as 24 hours. Okay, can any of you name common food that contains EDTA? Let's see over here in the chat box. What common food contains EDTA in it? Or if you don't know, just put no down there. If you do know, write it down. Very simple answer. Don't know. Question mark. No. 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 Okay. EDTA is a common preservative in frozen foods. Start reading the levels. So when you eat a lot of frozen foods, you're getting a significant amount of EDTA in yourself without the drip chelation. Okay? How many of you knew that? Yes or no? Let's see it in the chat box. No. Come on, type it in there. I want feedback on this. Yes. Pat Talk knew that. No, no, no. David Donaldson, yes. So a few of you knew that. So basically, when you're having trouble with parathormone, okay, you got to look at EDTA. In other words, the amount of frozen foods you're getting that have EDTA as a preservative in it. So I want you to start looking at those things and figuring this stuff out. As I say a lot, if you take very much of the nutritional stuff that I talk about, I take people off of far more things than I put them on, because I'm aware of things in food containers and things like that that's causing problems. I find that if I can just regulate the way that they eat, it solves a lot more problems than just giving them things, which I'm not against supplementing for a period of time, but we want to get at the cause of stuff. So here in this case, frozen foods, many of which contain EDTA. So if somebody eats a lot of frozen foods like frozen fruits, for example, in smoothies. A lot of people just eat frozen dinners when they go home. Stuff like that, start looking at those things, frozen peas, frozen corn. You got to tell them to start looking at the labels if they are having trouble with their calcium levels, okay? Parathyroid hormone stimulates osteoclasts, or bone resorbing cells, to engulf and destroy the bone tissue surrounding them. Actinomycin B inhibits calcium mobilizing effect of the hormone. Now, the mechanism whereby the solubilized calcium enters the bloodstream is complex. One hypothesis implicates the membrane-like curtain of cells, or osteoblasts, that surround the bone. These cells, under the influence of PTH, take up calcium and direct it to the extravascular fluid. The effects of PTH requires the presence of the active form of vitamin D. How many of you know that vitamin D supplements are not the active form of vitamin D? Let's see. Yes or no? Did you know that supplements are not the active form of vitamin D? Have a yes, a no, a yes, no. Dr. Jennings, yes. Okay, so it's kind of a mixed bag here. That's good. We're going to talk more about vitamin D and its effects. Dihydroxycholecalciferol is believed to induce the biosynthesis of a calcium transporting protein. Calcium is transported from the bone fluid of the bone cells by the carrier protein, which is a chelation. I refer a whole lot to chelations because sometimes the body chelates it. Most of the time with the minerals, you got to get it directly from the plants in chelated form. PTH and calcitonin then compete to increase or decrease the permeability of the membrane on the bone fluid side of the cell. Now that's one part of the equation. Passage of calcium is thereby directed into the intracellular fluid. In vitamin D deficiency, this transport of calcium from bone fluid to blood is inhibited. The PTH-stimulated mobilization of calcium from bone fluid to blood is inhibited. The PTH-stimulated mobilization of calcium is also triggered by cyclic AMP, the second messenger activated by magnesium. How many of you knew that? Let's see that in the chat box. PTH-stimulated mobilization of calcium is triggered by cyclic AMP. Yes, 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 yes. Okay, that's good. Did you know that it needed magnesium to activate the second messenger? All of cyclic AMP requires proper magnesium metabolism. How many of you knew that? See in the chat box, yes or no. Dr. Bagus, no. Patok, no. No. In the family? Okay, so a common place we can get magnesium, we think, is from whole grains. Correct? Everybody agree with that? Let's see that in the chat box there. Everybody knew the common source of magnesium is from whole grains. No. Yes. No. So kind of a mixed bag on that. Green foods, yeah, that's right. We're talking specifically about grains, but green foods, yeah, magnesium is in chlorophyll. That's what makes it green. It's identical to red blood cells, except it has a magnesium in the center instead of iron. Okay, and it's identical to vitamin B. except it has magnesium in the center instead of cobalt. Okay. Now, we have other issues though with magnesium. Okay, once the blood concentration reaches levels, yeah, plant blood, very good, slightly above normal, calcitonin is released. This hormone counteracts PTH perhaps by decreasing the level of cyclic AMP. The intestinal absorption of calcium is also an important factor in calcium homeostasis. Calcium transport is partly a passive diffusion and partly active transport. So it's partly passive, partly active. Although PTH affects the transport of calcium across the intestinal mucosa, the major factor is activated D3. And now vitamin D3 functions as its active metabolite and acts by inducing a calcium carrier protein, also chelation. We got two types of chelation here. The effect of this vitamin is blocked by actinomycin D. Since vitamin D3 and its active metabolites are synthesized in the body, the LUCA considers that this factor meets the definition of a hormone. Now, we've all heard it meets the definition of a hormone. Did you know the reason it's considered that way is it's because it's synthesized in the body? Let's see a yes or a no in the chat box. Did you know that vitamin D is considered a hormone because it's manufactured in the body? Good, good. Okay, no in there, several yeses. So some are learning some on here. Okay. Hyperparathyroidism is caused by a tumor of the parathyroid known as von Recklinghouse's disease. High blood calcium, low phosphorus, and high plasma alkaline phosphatase levels are found. Decalcification of the bones lead to deformities, fractures, frequently urinary calculi. Now, one of the ways that you can get urinary calculi, especially when you get older, is just sitting around, laying around, and not being active, because that in itself does not put stress on the bones, and therefore the body doesn't need the density in the bones, so it loses it. So basically, a requisite for keeping the density in the bones is activity, okay? And a very big thing leading to urinary calculi is a lack of activity, which causes bone mineral loss. How many of you knew that? Put that in the chat box there. A major cause of urinary calculi is inactivity. No, but makes sense. Couple yes, couple no. Okay, yes. Cysts in the bones are another characteristic of this disease. PTH is sometimes given as a treatment in lead poisoning. In chronic lead poisoning, the metal is deposited in the bone and salts displace the calcium. So lead is absorbed in the bone preferentially instead of calcium if you put both of them in there together. As one ages, the lead is released and elevated blood pressure and dementia ensues. So when you start losing the minerals out of the bone, then lead is released and it elevates blood pressure, and just like it affects the mentality of a child eating paint chips, it affects older adults in the same way. So the question is, how did the lead get in the bone? Had to have some sort of source of it. Most calcium supplements derived from egg and oyster shells have high levels of lead, also cadmium, aluminum, and copper. How many of you knew that most calcium supplements are loaded with high levels of lead, cadmium, aluminum, and copper? Let's see that in the chat box. No, yes, because of you. Yes, Dr. DeBagus. No, Dr. Jennings. Yeah, I've been on 6 medical and scientific boards, and with several MDs and several biochemists. We all disagreed on a lot of things, but we all uniformly agreed on lead. We said, do not use the cheap forms of calcium, because we all knew that they had these elevated amounts of these heavy metals if you use that, okay? The hormone tends to release the lead just as it does the osseous calcium, sending it into the bloodstream, permitting its elimination by the kidneys. Low selenium, high cadmium. Yep, that's one other thing. And there are also others that relate to that too. Thank you, family chiropractic there. Calcium forms insoluble salts with the number of anions that occur in the intestinal tract. Thus, we may find much of the calcium precipitated as the phosphate, carbonate, oxalate, or sulfate, or as calcium soaps formed when combined with fats or lipids, which are also insoluble complexes and therefore unabsorbable. Misspelled unabsorbable, sorry about that. This depends on the amount of soluble calcium salts present. The negative ions, which are anions, the pH, and the state of fat digestion and absorption. Calcium salts are more soluble in acid than in basic solutions. Furthermore, not all food calcium behaves in the same way. For example, the calcium of all vegetables is not uniformly absorbed. In some cases, the vegetables actually tend to depress the absorption of calcium from other foods. This may be caused by the presence formation of oxalates or phosphates, or to an influence on the pH of the intestinal contents. Insoluble calcium soaps form if fatty acids are present in large amount, resulting, of course, in diminished calcium absorption. We'll see a few surprises here. This one, vitamin D is a lipid, and when administered with calcium, combines with the calcium in a process called saponification, making a soap, and is rendered both inert and unabsorbable. Further, the vitamin D has to go through the liver and then the kidneys to be put in a form that can cause calcium to be absorbed. So the form taken with the calcium is not the form necessary for the calcium to be absorbed. First, how many of you knew when you take vitamin D with calcium that it forms an insoluble complex and can't be absorbed well? Let's see, yes or no in the chat box. No, no, no. Yes. Okay, Dr. Taylor knew that. Pat Talk, no. Family Chiropractic, yes. Okay, so a few of you knew that. That's why I tell everybody, do not take calcium with vitamin D, simply because it's a lipid and it forms an insoluble complex in the heat and moisture of the intestines. How many of you knew that vitamin D has to go through the liver and the kidneys to be put into the form that causes calcium to be absorbed? Therefore, the calcium in the form that's taken, or the vitamin D in the form that it's taken, is not in the form that is necessary for the calcium to be absorbed. So we presume, hey, the vitamin D is with the calcium, therefore it will help that calcium in that pill to be absorbed. We're wrong about that. How many of you knew that? Let's see, yes or no in the box there. Okay, Dr. Bagas, no. Dr. Taylor, yes. Donaldson, no. Okay, so we're learning stuff here. That's good. Phytic acid and its compounds also interfere with the absorption of calcium. These substances are abundant in unrefined cereals. Okay, so whole grains are loaded with phytic acid, and it combines with the calcium and it makes it unabsorbable. Okay, now let's take a look at this. Excretion of calcium partly through the kidneys, but mostly by way of the small intestine. Measurable amounts can be lost in the sweat. Calcium excretion in the urine is increased by the ingestion of carbohydrates, particularly glucose and sucrose, which somebody put up there before. So eating a lot of sugar causes loss of calcium. This may favor calcium salt precipitation in patients who form oxalate types of kidney stones. Okay, so here's another way that we can form stones with calcium. The most concentrated oxalate sources are spinach, beet greens, almonds. Oh, wait a minute. I thought spinach and almonds were nothing but good for you. Swiss chard, cashews, peanuts. Wow. So if we eat 2 large amounts of spinach, almonds, chard, beet greens, cashews, and peanuts, we might, if we're a certain susceptible person, we may form kidney stones very easily. High oxalate fruits include many berries, including blackberries, blueberries, raspberries, strawberries. Red or purple grapes, plums, currants, kiwis, and tangerine are also at the top of the list for high oxalate foods. Juices from high oxalate fruits will have high oxalate levels. So any of those, just the juices from them. Green vegetables that contain high oxalate levels include spinach, parsley, green pepper, leeks, olives. Olives? Wait a minute, I thought olives were nothing but good for you. And celery. Non-green vegetables, carrots, beets, beans, summer squash, and sweet potatoes. Black tea, hot chocolate, coffee, dark or robust beers. All those are high in oxalates, and in certain susceptible people, they can help form stones, kidney stones, oxalate stones. So, if you have stone formers in your practice, you can request these. I'll send them to you. That's what I made these up for. I don't want you to just look at them and say, oh my gosh, I missed that. You can request this from me. I'll gladly send it to you. I made this list to help you in your practice, okay? How many of you knew all of these things right here were high in oxalates and could really be devastating to stone formers in the kidneys? Let's see a yes or a no in the text box over here. No, 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 no. Okay, not very many there. I'll give you an example. I had an older lady come into me, and she had low calcium levels. And through the diet and manipulation of the calcium, which we're talking about right now, we rose it up into the normal level. She had it down pretty low level, about 8.7. You don't want to get there. You start getting into tetany. She was having a lot of muscle spasms. So we took steps like we're talking about here in this talk. And the one we had on fractures, osteoporosis, osteopenia. And I told her to stay away from high oxalate foods. And I gave her a list. And I emphasized spinach. A lot of people think spinach can do no harm. We see many things that spinach causes harm in. And her blood level was normal in a month. It didn't take long to bring it up, and she was low for a long time, years even. And then 6 months later, she calls up all irate. She says, I just had 3 kidney stones. I said, well, come on in. She comes in, and I went over the list of foods that she shouldn't eat again, which I still had a copy of. And she said, spinach. And I said, eating spinach? She says, yeah, 3 big salads a day. And I said, I told you, stay away from it, because when you get your calcium back up, it might cause you to form stones. She says, I don't remember you saying that. I said, you have this, and I even circled it for you. So she cut it out, and she quit forming stones. So, you and I are responsible for giving this information to people to help them not have it. It's not just a matter of giving them magnesium and B6 to dissolve the stones and get it out of the system, or manipulating the stones out within a few seconds like we teach in part 1. It's also informing them of things that cause stone formation, like these oxalates. And, you know, so we can get them out of there, but we've got to tell them what forms them too. Okay, so we give them this list. Say, hey, you know, quit eating so much of this. Wheat grains, including multigrain bread, pretzels, rye or wheat bread, and fruitcake, soybeans, and tofu. Tofu also have high oxalates. Black pepper, marmalade, and soy sauce are high in oxalates. Okay, so here's the whole grain breads again, whole grains. How many of you knew that whole grains and soy sauce, just those things right there, were high in oxalates and could help cause stone formation? No? No? Yes? Pat talk? Okay, so we've got a, you know, one that has knowledge of it. What's left to eat? Good question. Anything but those. Remember, this doesn't apply to everybody. It's just, are you a certain susceptible person? And are you just eating a lot of them? I never said you couldn't have them. Thing is that people go overboard with these things, and that's what the problem is, okay? It doesn't mean you have to stay totally away from them. Now, if you have stones, yeah, for a while, stay away from them if you have stones, just to get them out of your system. Let us help you get them out. But that doesn't mean that you totally have to stay away from them. It's easy to eat them at a reasonable level is what the thing is. That answer your question, Dr. Donaldson? Dr. Donaldson, I hear you snoring. Okay, that answered your question. Good. Okay, 99% of the calcium in the body is present in the bones, is in the form of hydroxyapatite crystals. This is in equilibrium with the plasma calcium, which is kept at a fairly constant level. Therefore, calcium hydroxyapatite is the best form of supplement to take, as it has all the requisite factors. How many of you knew that? Let's see that in the text box. Calcium hydroxyapatite is the best form. Dr. Jennings, how do you release these stones? That's part one. You either need to come to the seminar or get the film. Okay, Dr. Baggis knew this. Donaldson, no. Dr. Jennings, yes. Didn't know you could take it from that form. Yep. Okay, family, yes. Now, the best type of calcium, this is the only type that I recommend. Calcium hydroxyapatite from New Zealand and Australia from grass-fed bovine sources are the lowest in heavy metals. So that, therefore, that's the only type of calcium supplement that I recommend to people, because it never comes with vitamin D. Now, it has only traces of magnesium in it, which we're going to talk about in a minute, okay? So, several calcium nutrient companies know about this, and they will have it on the label from grass-fed bovine sources from New Zealand and Australia. They will have that on the label. Okay, how many of you knew about that? Let's see that in the chat box. No? Pat talk? Yes, DeBagus? Yes, Dr. Jennings? Dr. Taylor? Yes? Remember that from part 4, that's good. Dr. Donaldson, heard you say it before, okay. Very good. Okay, bone salt and plasma calcium shift back and forth as necessary to maintain this constancy. Nothing is static. Everything always fluctuates, always. And you need to keep this in mind. So there's always a span of from here to here. If you get much over that, much under that, it causes problems. So it's always going to be in a range, fluctuating in that range. And this is called the negative feedback loop. So if it goes toward the low side, and a negative feedback loop says, hey, put more in, and it puts more in. If it gets toward the high side, you have a negative feedback loop saying, hey, you're getting too much there, lower it down. So it lowers it down. So that's what keeps that range in there. Phosphorus should bear an optimal relation to the calcium of about 1 to 1. Foods richest in calcium are also richest in phosphorus. They usually occur together. Phosphorus is present in foods as phytates. Phytates are quite insoluble mixed calcium and magnesium salts of phytic acid, which in turn is a hexaphosphate of inositol. Phytic acid and its compounds interfere with the absorption of calcium, magnesium, copper, zinc, and iron from the intestinal tract, making them insoluble and unabsorbable. Unrefined cereals are high in phytates, so whole grains are high in phytates. Where unrefined cereals form a large part of the diet, the interference from calcium absorption may result in serious deficiencies of calcium, including the development of, and they even have a name for it, cereal rickets. This is why flour companies began taking the bran and germ out of flour, not for nefarious reasons as we've been led to believe. I believed that until I actually read the history of it, okay? So the recommended dietary allowance for phosphorus calcium is about 1 to 1. Cow's milk, however, is about 4 to 1. So phosphate is the form that it appears in, is an anion. Calcium is a cation, okay? So how many of you knew that before all this was known here, kind of early in the last century, they actually began taking the bran and germ out of the flour because far too many people were eating far too much whole grains, and they took it out to stop people from getting cereal rickets. How many of you knew that before? No? Dr. Taylor, yes. Mary Jennings, or Dr. Jennings, no. The Bagus, never. Yeah, we hear this stuff and we believe it because it kind of sounds good. Yeah, those evil processing companies take out the bran and the germ, and then they put back in 7 to 11 or 12 nutrients and charge us more for it, okay? So we say, oh, that's bad. No, the problem is they were eating too much of it. And it was causing a lack of absorption of all those minerals, and especially the calcium, let alone the magnesium, copper, zinc, and iron, okay? And it was causing a lot of problems. So basically, you need to tell this to your patients and tell them you cannot be eating a lot of whole grains with your meals, or you're going to start having trouble with your calcium, copper, zinc, magnesium, and iron. When you eat these whole grains with meals, it's going to cause a problem with the absorption of those, okay? I thought it was because the fats in them went rancid faster, low shelf life. Not so much because those people just bought it, you know, pretty fresh. And that's what it was. And a lot of them ground it themselves too, in home grinders. And that's a good input from Family Chiropractic there. But not so much true, because we're getting whole grains in bags right now. So if that were true, we still wouldn't be getting it, okay? Does that make sense, Family Chiropractic? If what you're saying is true there, okay, good. All righty. Drinking cow's milk, because it has a 4 to 1 phosphorus to calcium ratio, causes raising of blood calcium, but it's artificial. By liberating calcium from the bone to neutralize, that should be neutralized, sorry, excess levels of phosphate in anion, causing osteopenia and osteoporosis. I'm going to show you some documentation here. How many of you knew that cow's milk actually in bulk was bad because it raises the calcium artificially, okay? Dr. Taylor, yes. Donaldson, no. Jennings, yes. The Bagus, no. Okay. Now, magnesium spares calcium. When you have sufficient magnesium, you need less calcium, basically, okay? Magnesium and calcium compete for the same binding site in the intestines, neither are absorbed well when introduced together as supplements. Okay? Has more ilk, more osteoporosis. I don't know what ilk. I guess if you have more milk, you have more osteoporosis. That's right. I think that's what you're trying to say there. Okay, magnesium and calcium compete for the same binding site in the intestines. Neither are absorbed well when introduced together as supplements. So we either are taught to give people magnesium with calcium or vitamin D with calcium. They actually, both of them have issues here, okay? How many of you knew that calcium and magnesium compete for the same binding site when you take them together and neither absorb well? How many of you knew that? Dr. Taylor, yes. DeBaggis, yes. Are the rest of you asleep? Patok, no. Jennings, yes. Heard they needed to be together. Yeah, I know you heard that, but now you know different. Let's kind of put it in a different way. Okay, let's say you have a lion or dog or something like that. They kill an animal, they eat the animal, but they bury the bone. Okay, then they go back to the bone later. You ever think about why that is? Well, think about that a little bit. As we said before, bone meal has only a trace of magnesium. It has hardly any magnesium, so you don't get high amounts of magnesium in nature. And magnesium is in with the muscle, but there's also fat in the muscle. So the animals know by instinct that they don't want to mix the minerals in the bone with the fat and the magnesium in the rest of the body. Now, does that make more sense? Let's see that in the text box. Just looking at nature, they know by nature to do it that way. Family chiropractic, yes. David Donaldson, yes. Dr. Taylor, yes. The Baggage, yes. It's good. So we learn by observing in nature. That's good. Tannic acid, which is found in high amounts in teas, all teas. It's the thing that makes your tongue dry when you drink the tea. That's tannic acid. Including herbal teas also make insoluble complexes with calcium and render it unabsorbable. It also limits all those other minerals, magnesium, iron, zinc, and copper from being absorbed. Okay, so here we have an issue not only with taking whole grains, but drinking teas with your meals and during digestion is going to cause a problem with mineral absorption. I'm not saying drinking teas is bad. I'm just saying don't do it around eating and digestion when it's going to affect the absorption of these things. Okay, how many of you knew that? Let's see that in the text box. Dr. Taylor, yes. Donaldson, no. Patok, no. Family chiropractic, yes. The Baggis, no. Jennings, no. Okay, so some of us are learning things. That's good. Caffeine found in coffee, tea, energy drinks, soft drinks, except maybe Sprite and 7-Up, and chocolate also make insoluble complexes with calcium and render it unabsorbable. So you don't want to drink coffee or tea or energy drinks, soft drinks, or eat chocolate with your meals or during digestion, because that will block the same minerals from being absorbed. Okay? And calcium is the big one that we're talking about here. How many of you knew about caffeine in all these things causing a problem with absorption of those minerals and especially calcium? Let's see that in the chat box. Patok, yes. The Baggage, yes. Donaldson, no. Jennings, no. Taylor, yes. Family chiropractic, yes. It's good. Now, I emphasize it's not necessarily that they're bad, although I can make a case, for a lot of bad things in each of them for a lot of different reasons, okay? We already talked about tea, for example, causing problems with oxalates. But the question here is taking it with the rest of the meal and it causing a problem with absorption of those minerals, and for the sake of this lecture, especially the calcium. That's the issue. So I don't per se have a problem with them in relation to absorption of minerals or calcium, except when you're eating or digesting the food. Outside that, fine. You know, you have your afternoon tea, your morning coffee, half hour before you eat breakfast or something. That's fine. As long as it's away from the meal, it's not really causing that big of a problem relative to absorption, okay? Now, calcium is a sedative. So taking it early in the day makes one tired until it lowers in the blood. So basically what we're talking about here is when people come into me, I start asking them questions with chronic fatigue syndrome. And they're saying, oh, I'm just tired all the time, especially it's a woman. I say, are you taking calcium supplements? And they go, oh, yes, obviously I'm a woman. You know, I've been told to take 1,000, 2,000 milligrams a day. Okay, fair enough. Did they tell you that it's a sedative? Sedative makes you tired. One characteristic of chronic fatigue syndrome is that a person is really tired all day and then they start getting energy back about 2 or 3 in the afternoon, and they can't get to sleep till 2 or 3 in the morning, and they got to get up at 5 or 6 and start the whole thing again, okay? So basically, to positively affect chronic fatigue syndrome initiated by taking calcium supplement, take the calcium just before bed, and you'll sleep better and have energy during the day. So very simply, when I have a woman come in and she is complaining about being tired all the time and she's taking calcium supplements, I say, okay, who told you to take it in the morning? Well, my chiropractor, my nutritionist, my MD. That's basically when they all say to take it. I just say, okay, switch it and take it before you go to bed, because it'll help you sleep and you'll wake up refreshed. I'm saying quick turnaround, 3 or 4 days, they have all the energy they need. They were just having problems with when they took the calcium. How many of you knew that? Let's see that in the chat box. Dr. Taylor, yes. Patok, no. Family Chiropractic, yes. Vegas, no. Jennings, yes. Okay, some yes, some no. I take it that those that were yes took my seminar, and that's why I know yes. Okay. Foods that are, thanks for the reminder from Family Chiropractic. Dr. Taylor said yes, that's where I learned it. Thank you. Foods that are highly acidic or anions draw on calcium or cation stores to neutralize the excess acids. So, you know, that's a big thing. And so when I have somebody come in and they have low calcium levels, rather than just jump to saying, okay, you got to take calcium, I just start questioning them. I start questioning them on tannic acid, on caffeine, on oxalates, phytic acid, you know, those foods. I usually find out that's where the big issues are, okay? Now, here we also ask them, okay, what foods are high in anions that are, you know, causing a problem with withdrawing calcium out of the system? Now, first, you have sodium bicarbonate that's in the muscle. That's the first line of alkaline defense. But it's easily exhausted. So when that's exhausted and you're eating a high amount of acidic foods, then your body has to draw on calcium. It draws it out of the bones, out of the nerves. And basically, folks, when you have people with a lot of pain, just start looking at the calcium balance in here, okay? You'll be just totally surprised at how just recognizing the acidity and alkalinity of things can totally change away a whole pain pattern that's going on in people, okay? Just by recognizing this and starting to change around, you know, bone fragility and all this sort of thing. So foods that are high in anions. Examples are cooked animal protein, whole grains, acidy foods such as citrus, for example, tart foods such as kiwi, sour foods such as lemon and lime, foods hot to the taste without being heated, in other words, spicy, have volatile fatty acids, such as garlic, onions, cabbage family, kale, collards, turnips, radishes, mustard, cruciferous vegetables. Those are examples. Nightshade families, such as tomatoes, potatoes, eggplant, peppers, both hot and bell, paprika. Now, paprika is basically dried bell peppers ground up. That's what paprika is. These can only grow in soil pH of 6.2 or lower, and compared with most other plants, these are very acidic because of that. Okay, so there's a fairly complete list of acidic foods. So you have somebody presenting with low calcium levels. They're having a lot of troubles with pain. Just start thinking, and I'm not against you giving them things, but let's look at what's really causing it, okay? What's causing the loss of calcium out of the system, what's causing blocking the calcium from being absorbed into the system, okay? And instead of just giving them something, let's look at what's really the cause here. So then basically we raise up the amount of fresh raw fruits and vegetables, which are high in alkaline minerals, okay? So especially the peels, the pulp, you know, the rest of them, you have to eat the seeds. Those are the things that get the alkalinity back in there. If you want to see a quick turnaround in your most difficult patients, take them off of these acidic foods, take them off of the things that are blocking the absorption of calcium. Put them on fresh raw fruits and vegetables, even have them get a juicer that juices the whole plant, and immediately eat that, you know, some of that each day. I mean, you're going to see an amazing change in a matter of less than a week normally, usually 3 or 4 days, just a complete turnaround, okay? Okay, when you say animal protein, we're talking birds, fish. Animal protein is everything, okay? Anything that is not plant is animal, okay? When we're talking about ingestion of things, Dr. Taylor, okay? So fish, birds, fish, fowl, meat, yeah, any of that, okay? And it's the cooking that actually causes a lot of the problem, which we addressed that somewhat before in a previous lecture, okay? Now, I'm going to show you a couple of documents. Before I do that, does anybody have any questions on anything that we just covered? Any questions on anything that we just covered? Okay, good. Okay, good. Okay, so let's go up here and we're going to go to share screen. And I'm going to see if I can show you a couple of things. Okay. Here is consumption during teenage years and risk of hip fractures in older adults. Okay. So this is taken out of original investigation, January 2014, JAMA, Journal American Medical Association, okay? Each additional glass of milk per day, excuse me, sorry about that. Each additional glass of milk per day during teenage years was associated with a significant 9% higher risk of hip fracture in men, okay? That's pretty significant. Okay, so let's look at a different one. What about women? Okay, here's women. Now this is milk intake and risk of mortality and fractures in women and men cohort studies British Medical Journal, 2014. So both of these are relatively recent here, okay? High milk intake was associated with higher mortality in one cohort of women and another cohort of men, with higher fractures incidence in women, okay? Okay, well, what about that vitamin D question? I made a rather big statement on vitamin D. It didn't sound believable, okay? Vitamin D taken, I don't know why that didn't go right over that. Went to the side of it. Sorry. Let's try that again. Nope. Okay. Okay, here's the Lancet. All these are medical, large medical journals here. The effects of vitamin D supplements on bone mineral density, systematic review and meta-analysis. Significant detriment of vitamin D found in 2 studies. Okay, why? Because it actually blocked the calcium intake. It saponified the calcium supplements, basically. Okay. Okay. Now, all right. Does anybody have any question about anything that we covered tonight? We're going to go on to films that I'm offering, including part 4 that we're editing right now. I finished filming it, we're editing it. It has all this and a whole lot of other information. Any questions at all on anything that we've covered? Put it in the chat box right now. Okay. So let's take a look. Okay, videos that are available. So we're going to talk a little bit about videos. And we have 4 parts. 1, 2, and 3 are already out. Now, because you probably haven't heard about them before, in post-production, they're $500 for a year's viewing. Since you probably haven't heard about it, we're going to offer it to you if you get it today or tomorrow for $250 for a year's viewing. Now, it's basically got everything that I have in the seminars plus some, because we have to stop and let people work on each other in the seminar, so that limits the time. So, call my phone number, 469-995-9907, or go online, ttapcenter.com, under Seminars Professional. Go to the seminar that you want, and under requested location and film number, type in film under the one that you want. So if it's part 1, go to part 1 and type in film and your phone number. Then click the down arrow by $395 and choose $250. That way you can get that special price. Now, what are they about? Okay, TTAPS Film 1, use of myostatic reflexes to resolve pain and biomechanics of chronic neuromusculoskeletal conditions. Now, we've all been kind of hoodwinked into that joints and acupuncture and dense scar tissue outside the joints, such as in ART and graft and transverse friction massage. Everybody needs those things. Well, TTAPS Part 1, you learn nothing is further from the truth, and you can get amazing results on a variety of different conditions, such as normally get someone off a cane or a walker in 1 or 2 visits, or standing out of a wheelchair in just a few visits, if it's due to weakness instead of paralysis. And I have a super amount of people who've taken the course who've had, people come in like that, and they just can't believe how well it works, because it only takes a visit or 2 to do it. Now, if they're coming out of a wheelchair and they've been there a long time, obviously you have to get take care of the atrophy, and it's going to take a bit longer, but you can get somebody immediately off of a cane or a walker. And it's not that difficult. Immediately restore a significant range of motion. Understand how reciprocal innervation can immediately help restore function in distant parts of the body. Correct foot drop in the majority of cases. When you do that, you won't believe it. It happens 1 or 2 visits and the foot drop's gone. It's got nothing to do with adjusting the low back, okay? Cogwheel rigidity of the arm and leg of most stroke victims, or cerebral palsy. We've done both of those in front of classes. We did a cerebral palsy in California. A doctor brought in a woman in a wheelchair that had her arm like this, basically her whole life, and we started tapping on a certain spot, and it opened right up in a matter of seconds. Then we opened the hand up in a matter of seconds. And the caretaker of the woman couldn't believe it. The woman couldn't believe it. The doctor couldn't believe it. The class couldn't believe it. But it's easy. It's easy to do it. And you learn that in part 1. Improve hearing and tinnitus in most cases, and that's very quick. Okay, in most cases, quickly and significantly reduces or eliminates the following symptoms, usually on the same visits. Fulfills ACA evidence-based medicine best practices, and we're going to show you that document also here coming up. Okay, so get rid of fibromyalgia pain. Usually that only takes seconds to do. Fibromyalgia, of all things, yes, only takes seconds. Sciatica. We're talking about using standard orthopedic and neurologic tests when we're talking about this stuff, okay? We're talking about using the tests. Now, Pat Doc said, please forward the notes. Okay, you got to, okay, I don't retain this, Pat Doc. You're going to have to, you'll be offered that at the end of this. You can go on it and do it that way, or you got to contact me, drBBRK@hotmail.com, or call me 469-995-9907, okay? Either of those, but I don't retain this, so you're actually going to have to email me or text me or something so that, I can get it to you, okay? Because I can't do it off of this. So Pat Talk, please take this down and request it off of there, or click on the request. You're going to see that coming up on the Zoom also, so you can do it off of that. So sciatica, measurable by Lessegs. You get a quick resolving of sciatica. Herniated or bulging disc by Milgram's. Unoperated rotator cuff frozen shoulder syndrome. Regional pain syndrome, formerly RSD. Burning tongue or mouth, burning pain in the lower and upper extremities, genitals, female cyclical menstrual pain, vaginal prolapse, numb hands and feet, cranial nerve symptoms, such as measurable by nystagmus, strabismus, Weber's, etc., hearing loss of differing frequencies, tinnitus, foot drop, carpal ulnar radial tunnel syndrome, thoracic outlet syndrome, measurable by Phelan's, reverse Phelan's, Tyndall's, Addison's, cold or burning hands or feet, Raynaud's syndrome, loss of vibration sense in feet and toes, dizziness and vertigo, positive pinwheel test, bladder leakage, hyperhidrosis, MS symptoms, Parkinson's symptoms, vaginal prolapse, numb hands and feet, drop transverse and cuboid arches, polyhydrosis, cogwheel rigidity, ALS, Guillain-Barré symptoms, seizures. We'll show you how to stop a seizure in 15 seconds in progress, petit or grand mal, and get it not to come back again, okay? And a lot more than this, and this is all in part 1, okay? You're going to be amazed, we guarantee it. This is not reflexology, AK, CRT, PNT, TBM, transverse friction massage, spinal reflex therapy, contact reflex analysis, not any of those things. It's original with me. But it is based on known tenets of acupuncture, trigger point therapy, reflexes, and neurology, found in Laws and Tenets in Dorland's Illustrated Medical Dictionary, Chusage Neurophysiology, Guidance Textbook, Medical physiology and others is taught in all CCE accredited chiropractic colleges. We show you the references as we do it so that you understand where I came from when I came upon how to do this stuff. Treatment effects are verifiable by standard orthopedic and neurologic examinations. I am published in JMT and PT Chiropractic Economics on techniques being taught. I'm a former adjunct faculty member, postgraduate division, Texas Chiropractic College. Okay, film 2, Scar Tissue and Rehabilitation Seminar. Now, the first part of this is actually a continuation of part 1 because we just did not have enough time to put it in. First part of it's 4 hours, okay? Now, when we get to the scar tissue itself, which is outside the joints, dense scar tissue outside the joints, simply free up scar tissue between other tissues normally in one treatment. Now, ART, right in their seminars, say they take 4 to 6 treatments to free up a muscle. Graston, 6 to 10 treatments. Right in Cyriac's manual on transverse friction massage says 10 to 20 treatments. Those of you who do those, it's very difficult. Patient hurts a lot, takes a lot of effort on your part. They usually get bruised up. You don't need that. We show you literally how to take seconds to do it. Very little effort on your part, very little pain on the patients. Normally 1 visit. You get a lot more done on patients, treat a lot more things, and take a lot less visits, okay? Okay, if y'all, yes, I'm a technician, Dr. Taylor, haven't got the videos you need to. I keep going back to them as cases come up because I'm usually sport chiro, but I've helped drain 2 ovarian cysts, tinnitus, bunions, acid reflux, etc. It's opened up the practice a lot. They come in for MSK issue. Now I got them, that's musculoskeletal, and now I got them for a bunch of other issues. They refer all these new patients to me. Yeah, Dr. Taylor is really flying with this stuff. I'm mentoring him, and Dr. Taylor, you would agree that, you know, I'm a pretty good mentor too, right? I appreciate the comments there. He's just flying with it. He's taken me at my word, and he's actually using this on patients, sort of. Haha, thank you. Okay, thank you. Normally get someone off cane or walk in 1 or 2 visits. Okay. Okay, first thing we show you is how to very quickly, in less than 10 minutes, muscle test over 200 muscles in a person. And then lightly touch 1 muscle like this, and all the muscles come strong. The only exception being if there's a lot of atrophy in a muscle, it's going to naturally take longer. I don't care if you got 3 or 53 weak muscles, they come strong. You go right back and you retest the weak muscles and they're strong, okay? That way you don't have to, like applied kinesiology, go from muscle to do it. It happens just immediately, just like that. The second thing we do is you palpate the whole patient. You find all these painful spots, i.e. trigger points, and you palpate the whole body in less than 5 minutes, and you immediately decrease all pain. Inflamed areas usually take a bit longer by lightly touching 1 spot on them, and immediately go back, palpate, and pain's gone. Even the inflamed areas, the pain will go down 50% immediately. And it'll take a little while longer for it to go down. That way you don't have to go from trigger point to release it. Okay, so it really speeds up the results on people with a lot less effort for you, a lot less pain, a lot less expense to the patient. And guess what? You get a lot more referrals, just like Dr. Taylor, very quickly. They see that, wow, this doctor knows a lot. I'm going to start referring my friends into him. He's getting me well a whole lot quicker. She's getting me well a whole lot quicker. You know, this stuff works. In most cases, quickly and significantly reduces or eliminates the following symptoms, usually on the same visit. Now, I'm saying athletic injuries, but hey, anybody else. Now, I had to come up with a lot of this stuff by working on athletes. I've taken care of 12 professional athletic teams. over 3,000 athletes, over 800 of them professionals. And 3 of those professional teams were foreign nationals. And I was the first chiropractor invited to treat NFL patients at the NFL Run for Daylight and Fastest Man competition. I'm telling you, you haven't lived until you have worked on 72 or 73 football players in the hour right before the game, again at halftime, and again at the end of the game. Okay? So right there in that span, what, 3 hours basically, you treated maybe 230 visits. Okay? And that's with a big rest of gaps in between them for, you know, the halftime. You learn how to do things very quickly, very efficiently. Okay, so I had to come up with this stuff by working like that. So chronic athletic injuries, hamstrings, ankles, wrists, golfer's elbow, tennis elbow, rotator cuff, knee, turf toe, shin splints, chondromalacia patella, weak ankles, trick knees, plantar fasciitis, myalgia parasitica, bronchitis and asthma, gagging, esophageal spasm, reflux esophagitis, TMJ syndrome, migraine headaches, chronic whiplash, chronic hip and knee and ankle, shoulder, elbow, and wrist pain, tendonitis, bursitis, PC capsulitis, frozen shoulder, Dupuytren's contracture, trigger finger, Osgood-Schlatters disease, chronic fever, sore throat, scar tissue and acupuncture, old fractures and chronic pain, bone sclerotome pain, fibromyalgia, burning pain, resistant sciatica, small joint fibrous ankylosis, like in the fingers and toes, chronic shingles pain, arthritic finger and toe joints, unadhere organs from each other and stimulate circulation and lymphatic flow, diaphragmatic and accessory breathing muscle function, endonasal issues including balloon nasoplasty, eustachian tube techniques for chronic sinusitis, chronic migraines, true eustachian tube deafness, Meniere's syndrome, female cyclical menstrual pain, vaginal prolapse, dizziness and vertigo, drop longitudinal and transverse and cuboid arches, unexplained chest pain, MS, Parkinson's, ALS, Guillain-Barré symptoms, ankylosing spondylitis symptoms, seizures, resistant sciatica, herniated or bulging disc, rotator cuff, frozen shoulder syndrome, foot drop, hearing loss, frequencies, and I don't think we have on here, spondylolisthesis should be on there too. We show you how to correct spondylolisthesis in a matter of seconds. Just quite an amazing thing. Again, this isn't based on anything you've ever heard of before. I get the information and develop this out of standard textbooks. Okay. Film 3, adjusting, manipulation, mobilization. By the way, film 2, I will show you how to rehab somebody in about a fourth of the time. I need to put that in there too. Okay, so we told you about the rest of it. I'll show you how to rehab people in about a fourth of the time. Now, part 1 is basically reflexes alone with small amount of scar tissue in the skin. Part 2 is a continuation of that, plus short rehab time, dense scar tissue outside the joints. Part 3 is dense scar tissue inside the joints. Adjusting, manipulation, mobilization of extremity, cranial, and vertebra. Okay. I've treated and this should read over 40,000 patients. Sorry, it was a typo, from all 50 states and 97 countries. Okay. And first thing we show you is how to stand a patient up. And I call on somebody who has a lot of pain all the way up and down the vertebral column. We palpate the paraspinal vertebra and ask them, okay, I just call who has a lot of pain and tension all the way up and down the back. Usually 3 or 4 hands go up. So I palpate them in front of the class. You can see where they're reacting, you know, painfully. And I ask them, a lot of tension there, right? Yeah. Excuse me. Then I go to one spot on them. Takes me literally, you know, about 10, 20 seconds to diagnose where to do it. And I tap on a single vertebra like this, Wait about 10 seconds, repalpate them, and the pain and tension is gone all the way up and down the vertebral column. Now that gets rid of the compensatory subluxations, okay? Then we're left with the primary subluxation. So that quickly eliminates the compensatory subluxation, so we can find the actual other subluxations to adjust. So we can get most athletes back on the field in days in most cases, even if off for months. And we're talking people on the job and et cetera, people who have chronic problems. Wrist and costal cartilages, golfers and tennis elbow, chondromalacia patella, bunions, flat feet, high arches, drop transverse cuboid arches, reliably relieved reflux esophagitis, esophageal spasm, hiatal hernia should be on there. We show you how to osseously adjust a joint for hiatal hernia and reflux esophagitis. It's not like applied kinesiology or you're adjusting the stomach down. I've come to understand doing it this way that that's only a symptom. We show you how to osseously adjust a segment, very reliable, and immediately reflux esophagitis, hiatal hernia corrects. It's an osseous adjustment. Acromion and sternoclavicular joints, chondritis, costochondritis, hallux rigidus, hammer and claw toes, bow legs, knock knees. Show you how to correct knock knees. Same visit. It's just amazing. We had one girl that was a female chiropractor in Virginia. I asked to come up. She said to me, she lays on her back and I try to force her heels together. Couldn't get them closer than 14.5 inches. The whole treatment took about 30 seconds. Then I pushed her feet together. She stood up. She couldn't believe it. She stood up and her feet were together and her knees were together. She said, I've never had this even close in my life. Couldn't believe it. At the seminar we did in Austin just several weeks ago, had 3 people that we did that on. And it was immediately. One was about 5.5 inches apart, one was 4, one was 3. They all came immediately together. Bow legs tend to take a little bit longer for different reasons, but you can correct those too. Frozen shoulder adhesive capsulitis, rotator cuff, carpal tarsal ulnar, Guion, radial tunnel syndromes, and etc. Cranial techniques. And by the way, in this one also, that should have dementias in there. Sorry, that was left off. You can take somebody with dementias and adjust their knee, and immediately it causes their face to flush within seconds, and their cognition starts to come back. For example, a durable meds person came in and he brought his grandmother in, and he's a supplier, and he said, you know, can you help her out? And she was 89. He said she hasn't been able to recognize my parents, my sister and I, you know, for 2 years. And so I treated her. Her face immediately flushed. She turned around and called every one of them by name, you know, within 10 seconds after the adjustment. You couldn't see anybody more surprised than these people. But this is a predictable thing. You can get people out of dementia by adjusting the knee of all places. We show you the rationale for it and everything. Now, autistic children, I'm the only chiropractor on the recommended doctor list for autistic children in the state of Texas. And I had one doctor call me up. He says, I got to tell you what happened yesterday. And I said, okay, go ahead. Well, I adjusted the cranials like you showed in class. Here's this 5-year-old kid who never said any word to anybody, not parents or anybody, and both the parents were there. Did the procedure, which takes all of 3 minutes, and it's not a rough procedure. And he said, child looked up at me and said, thank you, doctor. He was floored. His parents were floored. First 3 words that he ever spoke. Had a female patient bring in her 21-year-old son, big guy, and autistic children tend to be angry all the time. They pace and they're just angry. And so she brought him in, and he, I went over and introduced myself to him, brought him up front, and I treated him. The whole treatment takes about 3 minutes. Immediately, everybody noticed he calmed down. He stopped pacing. Doctor called me 2 weeks later, patient said he laughed for 3 days straight after that treatment you gave him. His whole demeanor changed. Now, you can get these kids who are talking in squeaks or not talking at all, talking. And maybe saying one word, they start saying sentences, they say sentences, then they start speaking paragraphs, and they go into school with regular kids. It's all very predictable, okay? Stop elusive migraines, improve vision, hearing, tinnitus, organ and gland dysfunction, TMJ dysfunctions. We teach all of that. Now, all of part 1, 2, and 3 address the nervous system. The nervous system controls the secretory and excretory events of the body, okay? So people that have not been responding with nutritional intervention, just all of a sudden they correct when you correct the nervous system. And it's so beautiful because it was actually a nervous system issue that was causing the biochemical issue, okay? And a lot of doctors calling in and go, wow, I cannot believe it. You were right. It's changing their whole body chemistry. Now, part 4 is about strict body chemistry for those that have that. And I teach this in a different way. We take you through the biochemical interactions and negative feedback loops, okay? And we show you, because of the negative feedback loop, that you may have to intervene 2 or 3 steps before or 2 or 3 steps after where the symptoms are, which is actually where the cause of the problem is. So you can correct lower 0T in a matter of 3 or 4 weeks, okay? You can correct electrolyte problems, not from giving them electrolytes, but actually I show you where the electrolyte issue is coming from. We show you about problems with swelling in the joints and pain and tenderness and all that sort of thing, and where it's coming from biochemically. The inflammation issue, the problem with the mitochondria, the problem with the nuclear membrane, and et cetera like that, to help those things. We show you how to get stem cell treatment to take when, most of the time it doesn't take, and we show you why it doesn't take. So basically we go over all of that, and it's a whole different paradigm shift. And now I do have a Master of Biology emphasizing nutrition. It's all in class, not online. Not that I have anything problem with that. I'm also a Master Herbologist, Master Acupuncturist. I've been on 6 medical and scientific boards of nutrition companies. I performed over 15,000 nutritional assessments. So, for example, you take somebody who's allergic to virtually every food, feel like they can't eat anything. We get them to where they can tolerate most anything. Autoimmune disorders, we show you that it's not really what you think it is, not what you've been taught. Dysmenorrhea, excess and prolonged flow, correct that. Simple dietary corrections. Bone mineralization, infection, why antibiotics aren't working on people and why they have prolonged infections. And hormone imbalances, seizures, ulcers, bleeding ulcers, constant bloody nose, fungal and candida conditions, chronic fatigue. To show you how to correct chronic fatigue, matter of 2 or 3 weeks at most. Candida infections, fungal infections, 2 or 3 weeks maybe. We show you why supplementation really isn't working. Psychometabolic issues, viscerosomatic syndromes, etc. There's only a handful of things that's actually causing obesity, but we'll show you what they are and how to, why it recurs in 90% of adults after losing, over 40 after losing weight. We show you why that happens. Abnormal cell growth, cancers, behavioral disorders, hypertension, et cetera, et cetera. We show you how to take care of those. And so, I would urge you to get these programs. And again, you can have them for $250. You order them today or tomorrow. You can go online and get it that way. Now let's take a look at some other things here. Okay, I promised you evidence-based practices, evidence-based medicine and best practices. This is right off the ACA site, okay? And they basically got it from the British Medical Journal, okay? So you probably have not known really what those terms meant before, but we're showing you what they are. And basically, it says combine science with your experience. And that's evidence-based medicine and best practices. So you can have that. Just ask me to send it to you, and I'll be happy to. Just, again, email me for it, and we'll get it sent right out to you. Now, I do mentoring. Here are just a few mentoring testimonials here. And we want you to have the best practice you could ever imagine. I want you to have your goals. And I have the largest practice in the world. When everybody else's practice dropped 30 to 50% or more after 911, mine went up 1,700%. I maintained an average of 640 new patient calls every single month for years. You heard that right, month, not per year. 640 new patient calls every month. You can't do that if you don't know what you're doing. I can help you to have your dream practice, okay? Dr. B's mentoring program is second to none. This doctor is in California. Dr. Bonebreak's mentorship program is the best investment I've ever made. This is a doctor in Ohio. Since mentorship with Dr. Bonebreak, I've seen several improvements in my practice. See patients getting their desired results by using his treatment methods. This doctor's in Chicago. I wasn't sure I needed a mentor as I already thought my business was very successful. I attended Dr. Bonebreak's scar tissue seminar where I witnessed immediate changes on myself and my brother, and I observed other doctors with subjective and objective improvements in a short period of time. This doctor's in Texas, okay? You also can have those improvements. You just got to take the steps and do it. Now, I personally have had, I've taken 32 practice management, practice consulting courses. I've had practice coaching before. I always had, my practice was 5 to 10 times better than anybody given the seminar. But, you know, I learned something from each one, and I figured out, well, this is, you know, what I want to keep, and this is what I want to improve on. So, you know, I started doing my own thing and flew even better. So that's what you want to do. Preeminence mentoring is a good fit for anybody. It's all very affordable. Enables you to become top level, rapid, efficient patient response with scientific methodology found in medical literature. Become a nerve and biochemistry expert. I want you to become an expert, okay? That's how you get quick results. That's how you do this stuff. Get referrals from everywhere. Get paid what you're worth, low stress and better family time. Others committed and changed their lives. How about you committing and changing yours? It's your turn. Imagine having the business of your dreams, smooth running, plenty of highly satisfied and enthusiastic patients, as many as you want. Imagine having that. Financial security, time to enjoy your family, time to exercise regularly, and great health. 3 reasons why mentoring works for you. You will devote the effort, time, and dedication to get what you want. Charisma is not necessary. Listen to me giving these seminars here. You know, I talk monotone. I'm not very bright. You know, if I can do it, you can. I stumble over my words all the time. I am not David Singer. That guy runs circles around people with charisma. I am just not charismatic in the least. You don't need that. My practice is many times bigger than his ever was. I sustained a, you know, higher level, you know, patient referrals and et cetera, Group or one-on-one mentoring is very affordable. Your next step is commit to be superlative. Go to the link, ttapcenter.com, choose the mentoring level that fits you, commit to change your life. Mentoring includes 12-month group mentoring, one group call per week, 12 months, only $250 a month, one payment of $2,500. So you get an hour every week with a group, and you listen to everybody talk about their issues, and I tell them how to correct them. You listen, you put yours in, I answer your questions too. That's 52 calls over a year. It's $250 a month, or one payment of $2,500 saves you $500. We talk about anything you could ever want to know about your practice. We want to step you up to the level you want, desire. We want you to up your income dramatically, show you how to get paid for what you do, get answers regarding how to run your practice in the most efficient manner possible, think and reason quickly in any practice situation, give talks that gets a lot of new patients. My average weekly talk, and I've given over 1,000 lectures, and significant amount of just patient lectures. I averaged 35 to 50 every time I gave a patient lecture, and virtually everybody at every lecture became a new patient. I gave those weekly. You just need to know what to do and how to do it. Don't ask patients for referrals, get scads them. You don't have to beg for patients. They will want to bring them to you. Communicate in such a way as to draw referrals to you from all over. I said, I've gotten patients from all 50 states and 97 countries. No reason you can't have that, none at all. How to testify in important depositions, how to write narrative reports in the best manner possible, situation answers that solve your own situations, how to best treat given conditions for quickest results. People ask me about different parts of their practice. I leave it up to you, okay? What do you want to talk about on a given session? And I figure you know a lot more about your practice and where your holes are than I do because you've been in it. So we address those. I ask you to carry around a small notebook and write things down as they come to your mind so we don't miss them during your weekly call, okay? Commit now to achieve your dream practice. You can choose to step up to the 1-year one-on-one mentorship in the first 3 months and get those benefits as well. We're going to talk about that in a minute. Now, the 6-month one-on-one mentoring, you get a call per week. That's 26 weeks for $1,000 a month, or one payment of $4,000, which saves $2,000. So we talk about any of these things that we're talking about here. And that is just directed toward you. It's you and me, one-on-one. 1 hour a week, 26 weeks, okay? I cover what's at the top of your radar, okay? We show you how to communicate. It's a big deal, how to treat any patient issue. Big thing, the doctors like about talking with me, we can take care of the stuff in your office, marketing, motivation, all that, relatively shortly. They want to know how to treat conditions that come in and get them better, which is really going to stimulate patients coming in. But we show you how to, for example, if you have 10 patient calls, the average of just signing them up to come in is about 7 or 8 out of 10. And out of those that actually set an appointment, only 7 or 8 show up. So now you're down to 5 out of 10. And out of that 5 out of 10, only about 2.5 or 3 actually follow through with what you give them to do. Well, we show you how to, out of the 10 that call up, 9 or 10 out of 10 set an appointment, 9 or 10 out of 10 show up, 9 or 10 out of 10 follow through. I don't care if you have an insurance practice or you have a cash practice. It doesn't matter to me. I've had all of them. I've been 95% auto accident, 95% workers' comp, mixture of cash and all the above. I've been straight cash. Doesn't matter to me. People pay for what they want. It's that simple. If you show them you have what they want, they will come up with the money, okay? If you decide to step up to the 1-year mentorship in the first 3 months, you'll get all of its benefits on top of all these things. Now, the 12-month one-on-one mentoring, it's one call per week for 52 weeks now. So it's $1,000 a month or one payment of $8,000. So you save $4,000. You get all 4 films now with that. You get 12 seminars. Or when I start putting them online, you can pick them out of there too. They'll be just no charge for that. You know, we're going to put them up for CEs at some point in time here. We're going to create, after I'm done with the films, a link on your website for each part. And all those things I said, you know, could be accomplished. Well, I have thousands of testimonials from doctors and patients, okay? So we're going to create in alphabetical order different situations that were addressed, different diagnoses. We're going to put them on for each part, 1, 2, 3, and 4. And now when you start telling people about, you know, what you can do, they go, oh, yeah, I can't believe that at all. Then you say, well, go on the link on my website. There's a bunch of doctors and patients there who've taken that part and see what happened to them. Okay, now I did this on my own site, and it was good for 20 new patients per month per part. And I directed my established patients there too, and 20 average patients that were already established patients said, I didn't know you could take care of that. You know, I want to come in, you know, let's work on that too. So basically every month after I put this up, I got 160 new patients a month just from putting those links on my own website. Okay, we're going to make it broader than what I put it on. Now, even if you don't want to do the mentorship, you can still get that for $50 a month per part. Well worth it. Okay. Doctors' blogs. Here you get to talk with other doctors about the parts, and they're talking about what results they got using that part. It's just like with Dr. Taylor, you know, talking about the various things that he's getting here. Well, you get to talk with him about that, and you get to interact with them. And a good thing about it too, you're not just going to interact about my parts, although it's going to be germane to that, but they're going to come up with some of their own things they've seen work too. So you're going to build on your knowledge and my knowledge doing that. Okay, so you come out even better. And so those blogs, you get those free with it, or even if you don't want to be the mentorship, it's $50 per part per month. Well worth it. Well worth it. And you get all that with that. And again, it's one-on-one, you and me. And if you decide to extend for another year, which most do after that because they've seen just extensive results. We had multi-million-dollar practice guy. He was already real successful. He doubled his profitability taking my course in the first year. How would you like that to happen? When you have a multi-million-dollar and you say, oh, how could anybody possibly help me? He doubled his profitability in the first year. We show you how to do that. Commit now to achieve your dream practice. Don't wait. One thing that I did is I didn't wait for anything. I wanted something, I went for it. I didn't wait. I didn't wait for it to happen. Okay? Business results depend on your effort and following directions. So basically, you got to lose your excuses and take consistent action. You can't do that unless you start. If you do this, sign up. If you're not going to commit to it, don't. Simple as that. I don't want people in this who are committing and they're going to do it. Okay? I give you the information and encouragement, but you're the one that has to take action and improve your life. Okay? It's up to you. I give you the direction. I give you the encouragement. Family Chiropractic, another wonderful thanks class. Thank you for sharing. And I appreciate that, Family Chiropractic. Okay? So, now I'm going to ask a final time here, and we'll put it up again. Anybody have any questions over anything that we covered here? Anything? Just ask it now. We went about 10 minutes over. I apologize for that. But if you have any questions whatsoever, put it in there now. I'll put up my email again, drbbrk@hotmail.com, or my phone number if you want to call, 469-995-9907. And if you want to contact me, don't hesitate to do that. Otherwise, go on the website, and you can order directly with me, or you can go to the website and order, sign up for the mentorships is on there too. So, you know, any questions at all that any of you want to ask before we finish today? Any questions whatsoever, please ask them right now. All is good, Dr. Taylor, thank you. Okay. Okay, going once, going twice. Thank you so much. Next week I have a wedding I got to go to. My grandniece is getting married, so we're going to skip next week. So it's going to be 2 weeks for the next class. Thank you so much for tuning in here. And yeah, no skipping. Thank you. Okay, thank you so much. Have a really good week, and we'll see you in a couple.